If you're watching this right now, I want you to take a breath and know that you are in exactly the right place. I'm Dr. Fernanda Oliveira, a board certified urologist, and for over 15 years, I have been sitting across from men just like you. Men over 50 who are doing their best to stay healthy, stay strong, and stay in control of their bodies, and helping them find real, practical, affordable answers. That's what this channel is about. No expensive treatments, no gimmicks, just honest science and the kind of guidance I give my own patients every single day. And today, I want to talk about something that most men feel too embarrassed to bring up, even with their own doctor. So let me be the one to say it first. My dear friend, if you are getting up 2, 3, sometimes even 4 times a night to go to the bathroom, if your sleep is being broken night after night, if you find yourself planning your day around where the nearest restroom is, I want you to know something important. You are absolutely not alone. This is one of the most common concerns I hear from men over 50 in my practice, and there is no reason whatsoever to feel embarrassed about it. Millions of men are going through exactly this right now, and most of them have no idea that some very simple, very affordable natural habits can actually make a meaningful difference. Now, here is the part that surprises almost everyone. One of the most helpful compounds for supporting prostate comfort may come from something you have probably been throwing straight into the trash every single time you eat a certain fruit. And we are going to talk about exactly what that is. But first, I need you to understand what's actually happening in your body, because when you understand the why, everything else makes so much more sense. So let's start at the beginning. The prostate. Most men know they have one, but not everyone understands what it does or why it starts causing problems right around the time you turn 50. Here's the simplest way I know to explain it. Imagine a donut, and inside the hole of that donut, there's a thin straw. The donut is your prostate, and the straw is your urethra, the tube that carries urine out of your body. When you're young, that donut is small and firm, and the straw has plenty of room. But as men age, hormonal changes, particularly shifts in testosterone and a related hormone called DHT, cause the prostate tissue to slowly, gradually grow. The donut gets bigger, and as it expands, it gently squeezes that straw. The opening gets narrower, and suddenly, things that used to be effortless, emptying the bladder fully, sleeping through the night, having a strong, steady stream, start to require more effort or stop happening reliably at all. This is called benign prostatic enlargement, and I want to stress that word benign because I know that for many men, any conversation about the prostate carries a shadow of fear. But what we're talking about today is not cancer. This is an extremely common age-related change that the majority of men will experience to some degree after 50. I had a patient, a kind man in his early 60s, who sat in my office and told me he had just assumed this was part of getting old. Doctor, he said, I thought this was just what happens now. And I told him what I'm going to tell you. It may be common, but it does not have to simply be accepted without doing anything about it. Because here's what most men are not told. Age is not the only driver of what's happening to your prostate. There is another factor, one that is much more within your influence, and that is inflammation. Think about this with me for a moment. When any part of your body becomes inflamed, a swollen knee after an injury, a sore throat during a cold, that swelling creates pressure, restricts movement, and causes discomfort. The same principle applies inside your prostate. Chronic low-grade inflammation, the kind that builds quietly over time from diet, stress, disrupted sleep, and exposure to environmental factors, can worsen prostate swelling significantly and make urinary symptoms considerably more pronounced than they would be from natural growth alone. It's similar to the difference between a door that's slightly stiff because it's an old door versus a door that's swollen from humidity and pressing hard against its frame. Both doors are difficult, but the swollen one responds to treatment in a way the old one does not. When you reduce the inflammation driving that swelling, things begin to ease. Flow improves, urgency softens, sleep returns, and that is very much within reach for most men. So now you understand the two-part picture, natural prostate growth plus inflammation making it worse. And this is exactly where what I'm about to share becomes so interesting, because there is a compound, actually a family of compounds, found in extraordinary concentrations in something most people consider waste, that has been studied specifically for its effects on oxidative stress and inflammation in the body. And that thing is pomegranate peel. Yes, the peel. The thick, bitter, slightly waxy outer layer of a pomegranate that virtually everyone peels off and throws away without a second thought. As it turns out, that peel contains some of the highest concentrations of antioxidant and anti-inflammatory compounds found in any commonly available fruit. We're talking about polyphenols, specifically a group called punicalagins and a compound called ellagic acid, that have been the subject of genuine scientific interest for years because of how powerfully they appear to combat oxidative stress and inflammation in body tissue. And here's the part that really surprises people. Some research has found that pomegranate peel actually contains more antioxidant activity than the juice itself. The part we drink has less of these protective compounds than the part we throw away. Isn't that something? Now, let me explain what antioxidants actually do inside your body, because I think this word gets used so often that it starts to lose its meaning. Your cells are constantly under a kind of microscopic stress, produced by normal metabolic processes, by environmental exposure, by aging itself. This stress generates what we call free radicals, which are essentially unstable molecules that damage cell membranes and tissue over time. Antioxidants neutralize those free radicals. Think of it like rust protection for your body's cells. When rust starts forming on metal, it slowly weakens and degrades the structure underneath. Antioxidants prevent that process from taking hold, or slow it significantly when it's already begun. For prostate tissue specifically, which is under both hormonal and inflammatory pressure after 50, this kind of cellular protection matters enormously. When oxidative stress is reduced and inflammation is brought under better control, the tissue behaves differently. The swelling is less aggressive, the pressure on the urethra eases, and the symptoms that were disrupting your nights and your days begin gradually to settle. Now, I also want to mention circulation here, because it plays a role that most men never hear about in the context of prostate health. Healthy blood flow delivers oxygen and nutrients to every tissue in your body, and the prostate is no exception. When circulation is poor, healing is slower, inflammation is harder to resolve, and tissue health declines faster. Think of it like trying to repair a house without being able to deliver the building materials. The workers are there, the plan is there, but nothing can actually get done because the supply chain is broken. Good circulation is the delivery system for everything your body needs to heal and maintain itself. And the compounds in pomegranate peel appear to support vascular health as part of their broader anti-inflammatory effect, which is another reason this humble, overlooked ingredient is so worth paying attention to. I also want to say something clearly here, because I believe in being honest with you. What I share on this channel is educational in nature. It reflects the kinds of conversations I have with patients in my practice, and it is grounded in real science. But it is not a substitute for your own medical care. If your symptoms are severe, if you are experiencing pain, blood in your urine, or complete inability to urinate, please see a urologist right away. These are situations that need proper clinical evaluation. What we're discussing today is natural daily support for the kind of mild to moderate urinary symptoms that are so common after 50, not a replacement for diagnosis or treatment. With that said, the good news, and there really is good news here, is that the approach I'm going to walk you through is genuinely simple. It costs almost nothing. It starts in your own kitchen, and it's the kind of thing that, when done consistently, gives your body the conditions it needs to start responding. Now that you understand what's actually happening inside your prostate, why inflammation is making it worse, and why this overlooked compound from a fruit peel is worth your attention, I want to show you exactly how to prepare it at home, how to use it safely, and how to combine it with a few other simple habits that will amplify the effect considerably. But before I do, there are several common mistakes I see men make when they try natural remedies like this. Mistakes that can completely cancel out the benefits or even cause problems of their own. And one of them is something almost every well-meaning person does on the very first day. So let's talk about that first mistake, because I want you to get this right from day one. When most men hear about a natural remedy that could genuinely help them, the first instinct is completely understandable. They want results, and they want them quickly. So they dive in with enthusiasm, use it every day, use more than recommended, and then, when nothing dramatic happens in the first 3 or 4 days, they conclude that it doesn't work and they stop. And that, my friend, is exactly the wrong approach. And it's the reason so many men never experience the real benefits that consistent natural support can offer. Here is the truth about how prostate tissue responds to natural compounds. It is slow, deliberately, unavoidably slow. And that is not a flaw. It is simply the biology of tissue that has been accumulating stress and inflammation over years, sometimes decades. You are not going to reverse that in a weekend. What you are going to do is give your body a consistent, reliable daily signal through what you eat, what you drink, and how you live. And over weeks, that signal compounds. Inflammation begins to ease, tissue responds, symptoms gradually soften. I had a patient, a man in his early 60s, who came back to see me after 6 weeks of following a routine very much like what I'm about to share with you. He sat down and said, "Doctor, I slept through the night twice this week." He was almost surprised by it. That's what consistency does. It creates the conditions for your body to do what it is actually designed to do. So commit to at least 4 to 6 weeks before you evaluate whether something is working. That is my honest clinical recommendation. Now let's talk about the second mistake, and this one is about preparation and dosage, because more is not always better, and with natural compounds, getting the quantity right actually matters quite a bit. Some men hear about pomegranate peel and think, well, if a little is good, a lot must be better. But concentrated plant compounds, taken in excessive amounts or too frequently, can cause digestive discomfort and may interact with certain medications, particularly blood thinners or medications that affect how your liver processes compounds. So please, if you are on any regular medication, have a quick conversation with your doctor before adding anything new to your routine. I always say that, and I mean it sincerely. The preparation itself is beautifully simple. Start with an organic pomegranate if you can find one. Organic matters here because you are using the peel, which is the part most likely to carry pesticide residue on conventionally grown fruit. Wash it thoroughly under cool running water, then remove the peel and lay it out flat, on a clean cloth or a baking rack, somewhere with good airflow, away from direct sunlight. Let it dry naturally for several days until it is fully dried through and slightly brittle to the touch. Then break it into small pieces and store it in a clean glass jar with a lid. It will keep well for a few weeks this way. When you're ready to use it, the preparation is this. Take 1 teaspoon of your dried pomegranate peel pieces, place them in a cup, and pour 1 cup of hot, not boiling, just hot, water over them. Let it steep for 10 minutes. Then strain it, let it cool slightly, and drink it slowly. That's your pomegranate peel tea. Simple, affordable, and something you can prepare in your own kitchen tonight. I recommend drinking this 3 to 4 evenings per week, not every single night and not multiple cups a day. Consistency over moderation. That is the approach that works. Now, the third mistake I want to address is one that goes hand in hand with everything we've discussed about inflammation, and that is ignoring the other dietary levers that either support or undermine what you're trying to accomplish. Because pomegranate peel tea is not a magic potion that cancels out an inflammatory lifestyle. It works best, it works significantly better, when it's part of a broader, simple daily effort to reduce the inflammatory load on your body. And here I want to highlight one ingredient that costs almost nothing and that many of my patients have already started using after hearing me talk about it: cinnamon. Half a teaspoon of real cinnamon, Ceylon cinnamon if you can find it, added to your morning tea, stirred into oatmeal, or mixed into yogurt, provides a meaningful daily dose of anti-inflammatory support. Cinnamon has been studied for its effects on metabolic health, blood sugar regulation, and inflammation balance. And it is one of those ingredients where the science is genuinely encouraging and the barrier to entry is almost zero. You probably already have it in your kitchen. Use it. And alongside cinnamon, I want to mention ginger again, because if you watched my last video, you'll remember we talked about ginger in the context of circulation, and everything I said there applies here as well. A simple cup of ginger tea during the day, just a few thin slices of fresh ginger steeped in hot water for 10 minutes, supports blood flow, reduces inflammatory markers, and complements the work that pomegranate peel is doing in the evening. These ingredients are not expensive. They are not exotic. They are practical, accessible, and when used together consistently, they create a genuine anti-inflammatory environment in your body that your prostate can benefit from. Now, the fourth mistake, and this one specifically affects nighttime symptoms, which I know is often the most disruptive part of all of this, is drinking too much fluid in the hours before bed. This sounds obvious when I say it out loud, but I see it constantly. Men who are health conscious, who are trying to hit their hydration goals for the day, will drink a large glass of water or herbal tea right before they go to sleep. And then they wonder why they're up twice in the night. Your bladder fills at roughly the same rate regardless of what time it is, my friend. If you are putting significant fluid into your system an hour before bed, your body will process that fluid while you are trying to sleep, and your bladder will fill, and it will wake you up. It's not complicated, but it is something we often overlook when we're focused on doing all the right health things without thinking about timing. The practical guidance here is simple. Aim to stop most of your fluid intake about 2 hours before you plan to sleep. This doesn't mean you can't have a small sip of water if you're thirsty. Of course you can. But your main hydration for the day should be front-loaded, in the morning and early afternoon, with a gradual taper as the evening progresses. And your pomegranate peel tea? Enjoy it earlier in the evening, with dinner or shortly after, not right before you get into bed. There is one more thing I want to mention for the evening, and that is magnesium. Specifically, magnesium glycinate, taken at a dose of around 200 to 300 milligrams before sleep. And again, please discuss this with your own doctor before starting, particularly if you have kidney concerns or are on medications. Magnesium plays a role in smooth muscle relaxation throughout the body, including the muscles of the bladder wall. When those muscles are calmer and more relaxed during sleep, the urgency signals that wake you up in the night can become less insistent. Many of my patients who add magnesium to their evening routine report not only fewer nighttime trips to the bathroom, but also deeper, more restorative sleep overall. And better sleep, as I'm sure you know, has its own cascade of benefits for inflammation, hormone balance, and energy the following day. Everything connects. So now let me bring the whole picture together for you in the simplest way I can, because I want you to leave today with something you can actually start doing. Not a complicated program, not an overwhelming list, just a clear, gentle daily rhythm that supports your prostate health from multiple angles at once. In the morning, hydrate well and include something anti-inflammatory. A pinch of cinnamon in your breakfast, a cup of ginger tea, foods that are colorful and whole rather than processed. During the day, move. I cannot overstate how much short, regular movement, even just a 10-minute walk after meals, supports circulation and reduces the inflammatory burden on your body. Your prostate is a tissue that depends on good blood flow, and movement is one of the most powerful tools you have for maintaining that. In the evening, keep your dinner light, finish your main fluid intake a couple of hours before bed, and enjoy your pomegranate peel tea earlier in the evening rather than late. And before sleep, consider your magnesium, that quiet, gentle support for muscle relaxation and sleep quality. That is the routine. Morning nourishment, daytime movement, evening calm. 4 small, affordable, realistic habits that work together to reduce inflammation, support circulation, and give your prostate the conditions it needs to respond. And what might you notice if you follow this consistently? The early signs that many of my patients report are usually this. First, sleep begins to improve. Not dramatically overnight, but gradually with fewer interruptions. Then the stream may feel a little stronger, a little more complete. The urgency that used to send you rushing to the bathroom may become a little less pressing. One man I worked with, in his early 60s, came back after about a month and told me he had started sleeping through to 5 or 6 in the morning without waking, something that hadn't happened in years. He said it quietly, almost like he didn't want to jinx it. And I told him, that is your body responding. That is what consistency looks like from the inside. I want that for you. I genuinely do. And I want you to hear this clearly, my friend. There is absolutely no reason to feel embarrassed about what you've been experiencing. These symptoms are common, they are biological, and they are not a reflection of weakness or failure. They are simply a signal from your body that it needs a little more support than it used to. And that support does not have to come in the form of expensive prescriptions or complicated treatments. Sometimes it starts with a piece of fruit peel, dried on your kitchen counter, steeped in a cup of hot water on a quiet evening. Start tonight. Wash a pomegranate, set the peel out to dry, and while you're waiting for it to be ready, start with the cinnamon tomorrow morning and the ginger tea in the afternoon. Let the routine begin to take shape one small step at a time. And if this resonated with you today, if you're going to give this a try, I'd love for you to leave a comment below and write, I'm trying this tonight. It helps me know that this information is reaching the men who need it most. And if you haven't subscribed yet, please do, because every week I bring you this kind of honest, practical, science-grounded guidance for men over 50. And I don't want you to miss what's coming next. Your body still has a remarkable ability to respond when you support it properly. I see that every single day in my practice, and I believe it for you too. Take care of yourself, my friend. I'll see you in the next one.